Welcome to the Deep Dive. Today we're tackling a really critical issue, operational stress in first responders. You know, the people who are right there for us, EMTs, firefighters, healthcare workers, law enforcement.
Yeah, the pressure they face daily is just immense.
It really is.
Yeah.
And it's not just physical, is it?
Not at all. The mental, the emotional toll,
Mm.
it's profound. It can stick around for a long time.
Exactly. So for this deep dive, we're looking at info from Sierra Health Plus Wellness. They focus specifically on this.
Good source for this topic.
Our goal today, to really get a handle on what operational stress actually is, how it hits first responders uniquely, and, what help is out there.
Right. To give you all solid understanding fast.
So let's define it first. Operational stress. What are we talking about?
Well, fundamentally, it's the mental and physiological strain. It builds up from being in those demanding high-pressure jobs constantly.
So not just one bad call.
Not necessarily. I mean, those big traumatic events are definitely part of it, but it's often the cumulative effect, the day in, day out stuff, the constant on state.
That on state. Yeah, always waiting for the next thing. Sounds exhausting.
It is. And that's why first responders are, well, more vulnerable. They see traumatic things much more often than most people.
Which leads to higher rates of mental health issues.
No, exactly. Which brings us to this term, operational stress injury, or OSI.
OSI, okay.
Now, it's important to know this isn't like a formal diagnosis like PTSD in the DSM manual.
Not clinical.
Right.
No.
It's more of a broader term. It describes those persistent psychological difficulties that can come from trauma or just long periods of high stress and fatigue in the job. Military members, too, not just first responders.
Okay, so OSI is kind of the umbrella term for these ongoing struggles.
You got it.
And what specific conditions tend to fall under that umbrella for first responders?
Quite a range, unfortunately. The sources point to PTSD, obviously, but also other trauma issues, anxiety disorders, depression, and importantly, substance use disorders, alcohol, drugs. Sometimes linked directly to trauma, sometimes more from the overall stress.
AUD, SUD, alcohol use disorder, substance use disorder. Okay.
Yeah, and they often overlap, One condition can make another worse.
That makes sense. Coping mechanisms, right?
Exactly. And the amount of trauma exposure is staggering.
I saw a statistic, I think, from a U.S. survey. Something like 67% of EMTs reported being physically assaulted on the job.
67%. Yeah, it's alarming. Think about that. 2 out of 3.
Just trying to help people.
It really brings home the danger they face. And that's just physical assault. Add in the emotional trauma of witnessing terrible things constantly.
Yeah, it's a recipe for high rates of PTSD symptoms.
Definitely. And the numbers bear that out.
How high are we talking?
The information suggests anywhere from 7% up to maybe 37% of first responders show PTSD symptoms.
Wow, 37%. That's more than a third in some groups.
It's significant. And that's alongside depression, anxiety, other issues too.
It feels like there's a disconnect. We need them to be strong, but are we really helping them deal with the fallout?
That's a really important question. And the impact isn't just mental. It hits physically too.
How so?
Well, the sources link PTSD in first responders to things like chronically high cortisol levels, that's the stress hormone,
Right.
higher resting heart rates, poor sleep quality, really tangible physical effects.
Sleep disruption must be huge.
Oh, absolutely. And there was a Canadian survey, too, that found paramedics often struggled with alcohol abuse, specifically after traumatic calls.
It really shows that mind-body connection under stress.
Totally linked, which
Yeah.
also means, focusing on physical health could really help their mental resilience.
Okay, so let's break down the components of operational stress itself. The sources mention anxiety, fatigue, and emotional stress. Let's start with anxiety.
Right. So the job itself, right? High
Yeah.
stakes all the time. Uncertainty. Life or death decisions under pressure.
Constant pressure.
Exactly. And that constant exposure can lead straight to chronic anxiety. Not just worry, but real issues like trouble concentrating, irritability.
Which can impair their judgment in critical moments.
Potentially, yeah. When clear thinking is everything.
And then fatigue. This isn't just feeling tired, is it?
No, this is deeper. Physical and mental exhaustion. Long hours, tough workload, not enough rest between shifts.
Just running on fumes.
Pretty much. And over time, that really cuts down their effectiveness, increases the chance of errors, makes the job much less satisfying, too. Imagine making those split-second calls when you're completely drained.
It's a scary thought. And the last one, emotional stress. Seems unavoidable.
Absolutely. Dealing with trauma, suffering, death. day after day. It takes a huge emotional toll.
Yeah.
And if you don't have good ways to cope, that strain can lead to feeling numb, burning out, or developing PTSD. Like your emotional battery just keeps getting drained.
And the pace of the work just makes all this worse, right?
Yeah.
I saw another stat, 69% of EMS pros said they didn't have enough time to recover between traumatic events.
Almost 70%. Yeah, that's huge. It points to a systemic problem, really.
No time to process.
Exactly. No time for that mental decompression.
Yeah.
So the experiences just pile up, leading to more depression, stress, PTSD symptoms, relationship problems, even suicidal thoughts in some cases.
It's a dangerous cycle.
A very vicious cycle. Needs breaking.
Okay, so we see the components and the impact. Are there things that make some people more likely to experience severe operational stress? Risk factors.
Yeah, the sources highlight a couple of key things. One is using avoidance strategies.
Avoidance, like what?
Like trying not to think about the tough stuff, denying how it affects you, putting off dealing with feelings, maybe pulling away from people.
Trying to just ignore it.
Right, which might feel better for a minute, but long term, it makes things worse, and it stops people from reaching out for help when they need it.
Makes sense. Avoiding problems usually doesn't solve them. What's the other factor?
It boils down to coping skills, or the lack thereof. People who rely on unhealthy ways to cope, maybe drinking too much, getting aggressive, isolating themselves, are much more vulnerable. Compared to those who've learned or actively use healthy coping skills, things like, good problem solving, managing emotions effectively, resilience training, they're just better equipped.
So it sounds like tackling this needs, well, a couple things. Preventing it where possible, but also treating it when it happens.
Exactly right. A dual approach. And that's where places like Sierra Health Plus Wellness come in. Their approach is described as comprehensive, meaning they look at the whole person holistic. They handle co-occurring issues like substance use alongside the stress that's a dual diagnosis. They understand trauma-informed, and they use methods that are proven to work evidence-based.
That multi-layered approach sounds crucial.
It really is for lasting recovery.
So when we talk treatment for these OSI issues, what does that look like?
Professional support is key. Therapy, counseling, designed to help process the trauma safely.
Talking it through.
Yes. And peer support groups are incredibly valuable too, connecting with others who get it, who've been there.
That shared experience must be powerful.
Immensely. And often, addressing any substance use has to be part of it. But the big message is, asking for help is strength, not weakness.
That's so important to emphasize.
And getting help early can save months, even years of suffering.
You mentioned resilience training earlier, too. What's involved there?
It's about giving people tools, practical strategies to handle stress better and bounce back. Often involves mindfulness.
Being present.
Yeah. Emotional regulation techniques, and cognitive behavioral stuff, learning to spot and change negative thought patterns, basically building up those coping muscles.
And are there simpler, everyday things people can do? Stress reduction techniques?
Oh, absolutely. Things like meditation, deep breathing exercises, relaxation techniques, they can make a real difference in managing that daily buildup of stress and tension.
Simple but effective.
Sometimes the simplest things are.
And work-life balance must be extra critical here.
Essential. Getting enough rest, actually taking time off, disconnecting, having strong support systems outside of work, all vital for preventing burnout and aiding recovery.
You mentioned dual diagnosis treatment again. Why is that integrated approach so important?
Because often the stress or trauma and the substance use are tangled together. One fuels the other.
A vicious cycle again.
Exactly. So you need to treat both at the same time in a coordinated way. Teach coping skills for both relapse prevention and managing the underlying anxiety or trauma. Treat the whole person.
Makes sense. And what about the physical side? Exercise, diet, sleep.
Huge factor. Physical wellness is the foundation. Regular exercise is great for mood and stress. Good nutrition fuels the brain and body. And quality sleep, absolutely non-negotiable for restoration and resilience.
So taking care of the body helps take care of the mind.
Without a doubt, it boosts their ability to cope with everything else.
We touched on self-medication earlier, that downward spiral. What about when someone isn't reaching out? Intervention.
Yeah, it's tough. Sometimes people turn to alcohol or drugs just to numb the pain, Temporary escape.
But it makes things worse.
Always, in the long run. It masks the real issues. So if someone is really struggling, maybe in denial, sometimes a professional intervention is needed.
How does that work?
It's usually planned carefully. Family, friends, maybe a professional. Come together to talk to the person. Gently but clearly express concern, offer help, outline a path to treatment.
Must be difficult.
It can be emotional, yeah, but it can also be the turning point. It can break through the denial and get someone into the recovery they desperately need.
A vital step sometimes. Now, thinking proactively, are there things first responders can do before facing major stress or deployment?
Yes, definitely. The sources mention a couple of key pre-deployment steps. First, self-awareness.
Knowing yourself.
Knowing your own vulnerabilities, your triggers. Recognizing the early signs of burnout or compassion fatigue, that deep emotional weariness.
Okay, and second,
Planning for self-care during the high-stress period. Actually scheduling breaks, prioritizing sleep even if it's hard, focusing on nutrition, trying to get some exercise in.
building in those protective habits beforehand.
Exactly. Create buffers against the stress.
And Sierra Health Plus Wellness, you mentioned their continuum of care. What does that mean practically?
It means they offer support at different levels. Inpatient care for intensive treatment, outpatient programs for ongoing support during reintegration.
So, different stages of recovery.
Right. Plus, those specialized dual diagnosis programs focused on trauma. It lets them meet people where they are and give the right level of help.
That flexibility sounds important. And if someone listening needs help or knows someone who does,
There's confidential help. The number for Sierra Health Plus Wellness is 866-303-6275.
866-303-6275.
Yep. And their website has more info too, sierrahealthwellnesscenters.com. The main thing is, don't go through it alone. Reach out.
Okay, so wrapping up this deep dive,
Mm-hmm.
it's clear operational stress is, well, it's a huge deal for first responders. Complex, challenging.
Very real. We've seen how the constant trauma, the tough environment, not enough recovery time, it all takes a serious toll, mentally and physically.
And understanding those pieces, the anxiety, the fatigue, the emotional strain, and the risks, like avoidance or poor coping, that's the first step, right?
Absolutely. Understanding it helps us as individuals and communities address it better.
And the good news is there are solutions. Support is available. Therapy, peer groups, building resilience, focusing on wellness.
And asking for that help, again, it's strength. Places like Sierra Health Plus Wellness offer that specialized care.
So, would be the final thought for everyone listening.
Yeah.
How can we, the broader community, do better?
Yeah, that's the big question, isn't it? How do we truly support the mental health of these folks who are always on the front lines for us?
What changes, what awareness could really make a difference in preventing or addressing this operational stress?
Something important to think about long after this conversation ends.